A healthy heart is the key to a healthy life. You don't have to wait until you have heart disease to take care of your heart. The Catholic Health Preventive Cardiology program is designed to reduce the risk of a heart attack, stroke, and other chronic conditions associated with untreated cardiovascular disease. On today's show, we'll learn more and meet the providers who will be caring for you and your loved ones. You're watching Stronger Together with Dr. Dave. Hello and welcome to Catholic Health Stronger Together with Dr. Dave. Today we're talking about preventive cardiology. Joining me now is the Director of Preventive Cardiology at Catholic Health, Dr. Thomas Pappas. Dr. Pappas, thank you for joining us.
Thank you for having me.
So you're a really important person to speak with because we have an issue in this country still, and although cardiology has come a long way over the last 4 decades or so, reducing the risk of cardiac death by over 50%, 1 in 5 Americans still die from heart disease. Every 40 seconds in this country, somebody has a heart attack. So although we've made a lot of progress, we still have a long way to go. And I think a part of that solution is somebody like you, the Director of Preventive Cardiology. So what exactly is preventive cardiology?
Well, I think probably the number one cause of death in the world is cardiovascular disease. And I think the goal of the Preventive Cardiology program would to identify and manage the risk factors for this. And I think it's nice to pick it up early in life. You know, the risk factors would be, there are 5 risk factors that are important. One is diabetes. And diabetes, 80% of people with diabetes can die from cardiovascular disease. So I think to address diabetes and to tackle the hemoglobin A1C to keep it below 7, I think is ideal. I think the other factors are hypertension. I think hypertension also leads to heart disease, and I think that if we keep the blood pressure 130/80 and less, I think that's phenomenal. The other issue would be hyperlipidemia, and basically there's a lot of reasons to control hyperlipidemia, but I think that that's something that we need to be on top of. You know, if someone has some risk factors other than hyperlipidemia, you may want that LDL to be below 100. But if they have plaque in the coronaries, you want it below 70. If they have stents, bypass surgery, if they have heart attacks, you'd like the LDL below 55. I think it is important. Cigarette use is also another factor. That's one of the top risk factors, and I think that's something that we do have a cigarette cessation program, which we need to tackle. And then the last thing is family history and genetics. I mean, genetics is really a big part of this. And I think we have to take a very careful family background. I think if I see someone in my office who's 40 years old and he tells me that his father died from a heart attack at age 35, I say, well, we need to be on top of this. So family history and genetics, I think, is another factor that we have to address. And then there's 2 other things. One is obesity. You know, obesity can lead to diabetes. It can lead to high blood pressure. And I think that's something we have to address. And then there's also the inflammatory conditions like rheumatoid arthritis, psoriatic arthritis, lupus, because those are very inflammatory conditions that could really, really inflame the blood vessels, and that's why plaque might start to build up in those coronaries. So I think that those are the issues that we like to address early in life before they really become a big factor down the road. Yeah.
So who should be reaching out to Catholic Health's Preventive Cardiology program? There's a lot of people watching this show right now.
Right.
Just roughly, who would you say should reach out either to the program directly or have a discussion with their primary care doctor about being screened for cardiovascular disease?
Yeah, I think that if someone knows that they have a family history of heart disease, or if they know they have these other risk factors, then I think on our website there will be a phone number they can contact. And the person who navigates her name is Kaitlin Kalogeras. She's phenomenal. She's a PA. And she has a phone number that will be posted on the website, and they will call that number, and then she can take that number and she can ask a lot of questions. She'll ask like a heart healthy quiz. She'll ask about background, things like that. And then once she gets all those questions answered, she may want to then triage the patients to different doctors within the system. So I think that first of all, if she asks her, do you have diabetes? The answer is yeah. If they have diabetes, then she'll triage them to an endocrinologist. If they have obesity, we have an obesity center that they can triage people to. Pratibha Vimulapalli is one of the directors of the obesity program. If they have cardiac issues, if they have screening for cardiac issues, as we discussed, I think that calcium scoring, phenomenal. I think if you have a calcium score that's 0, that's a good thing.
So let me stop you right there, because people watching, they may not know what a calcium score is.
Right.
In just a couple of sentences, what is a coronary calcium score?
Right. If you have even beginnings of plaque in the coronary arteries, calcium loves to stick there. And calcium, it like lights up like a Christmas tree on some of these CAT scans. And so I think the calcium score is something that will be something that you can detect early in life to prevent that from becoming an issue down the road. And that's why the CT scanners, it's not covered by insurance, but basically it costs $100, $150. And really, if you do a calcium score, it's a CAT scan, it takes 3 minutes, no contrast, no IV, nothing. And if they scan your heart, the calcium lights up like a Christmas tree, and you'll know right away that someone does have even premature plaque buildup.
So the higher the calcium score, the higher the plaque, the amount of plaque in somebody's heart, the higher the chance of having a problem, a heart attack, et cetera.
Exactly.
Right. And,
exactly.
And the flip side, and this is why I personally love the calcium score, is if you have a calcium score of 0, we almost tell people they have a warranty period on their heart for a few years.
Right.
And a lot of times I'll see patients with a calcium score of 0 and I'll take them off meds because they really don't need the medicines until we start to see plaque building up.
Yep.
Right? I mean, unless they want to be ultra preventative and proactive, then that's fine too.
Right. No, I agree with you. I think that's a good idea.
Yeah. So okay. So we have risk factors. We have the technology. We have the coronary calcium score, which I agree with is probably the best first step.
Oh yeah.
Because it's easy, very easy to scale. And then of course we have treatment. So I would argue that I would argue that all heart attacks are preventable. There are those very rare hypercoagulable states, very rare familial dyslipidemias, LP(a) we're not aware of.
Right.
Yes, those people can get into trouble, but I would argue the vast majority of heart attacks, stents, bypass are preventable. So if somebody is watching this show and they heard their neighbor had a stent or another neighbor died suddenly from heart disease, they really should call and start to inquire as to whether they would be a good candidate for your program. So I would argue, yes, the risk factors are important. So if people are watching this show and they have risk factors, that's a no-brainer. They should absolutely either call directly or have the discussion with their primary care doctor. But I would also argue if you're a male over 40 and a female over 50, I don't think it would hurt to call and just get more information as to whether they should be screened. What are you doing in your own practice?
I think at this point, I'm very proactive. I think if someone comes in to me at age 35 or 40, I'm going to be on top of them. I'm going to say, we got to watch your blood pressure, we got to watch your cholesterol level. The LP(a), as you said, is a phenomenal test.
Yeah.
It's a great marker. Someone might start to get plaque in the arteries. I think it's a wonderful test to do. We don't treat it. It's basically
not yet.
It's not yet, yeah. Right? They're out there making, doing some kind of experimental studies with it. But basically, if the LP(a) is elevated, we got to be all over it.
Right. So LP(a) for the viewers is a very sticky LDL.
Yes.
Right. It mimics something called plasminogen, which is a procoagulant.
Exactly.
So not only is it a cholesterol particle, it can cause clotting.
Right.
So, and like you said correctly, many times we didn't check for it because we didn't know what to do with it. We didn't have a treatment.
Right.
But there are medicines hopefully coming out in the next year or two that we can treat.
Yep.
So people need to think about these things. I always tell my patients that family history has to start with somebody, right? So even not having a family history is no guarantee that you're not going to be at risk.
Right.
I treat the coronary calcium score and screening like a colonoscopy. Right? Probably more important, not to say colonoscopies are not important, they're very important, but far more people die from heart disease than the top 5 cancers put together.
Yep.
Right? So we have to do better.
I agree.
So you mentioned obesity.
Yes.
How are you dealing with obesity? Are you doing any of this stuff from a cardiology perspective, or are you also saying
I think that I will refer them to Pratibha Vimulapalli, who does run the obesity center at Good Sam, but also she'll be in Roslyn. And basically, she does run the program for obesity. She may have counseling. She may do other procedures to get the obesity down, but she definitely runs that program very well. And then there are other issues too. I mean, there's genetics. We have a genetic counselor in our program who's Dr. Mahmoud, who does a lot of genetic background testing. Then we have a cigarette cessation program, a lipid clinic, and then we have you know, a lot of other things that I think we can get people into.
Yeah, it's really amazing because if you call this number and you get plugged into the CHF Preventive Cardiology program, it's not even just about the heart, like you're saying. It's really like branches of a tree, whether it be, you know, dealing with weight. They have nutritionists on. They have. We've had on this show physical therapists who design exercise programs for people.
Yes.
So if people really want to be proactive, we give them the tools to be proactive. They just have to call. They just have to reach out.
Yep.
So where do you see cardiology going? Preventive cardiology. Are we just going to keep stenting everybody and doing bypass surgery, or is there a way out of this mess? What is the way out of the mess in terms of your?
Well, as former director of interventional cardiology at St. Francis, the cath lab, I think you know, I think we're going to do a lot of screening of people out in the public. If they have heart disease, I'm going to send them to the cath lab. If they don't, then, you know, we'll be on top of it and try to prevent things from happening down the road. I think that's a good thing. The other issue that we have is there's something called integrative medicine, and it's run by Dr. Robert Graham and Dr. Anthony Ardito, and it's kind of a holistic type program where basically, you know, we can triage patients to that part if they want to be holistic and whatnot, and those guys can really run that program very well. And you know, if there's other issues, then they can maybe send them back to us to be preventive cardiology. But I think that's part of the program. Is Dr. Graham and Dr. Ardito are part of the program.
Yeah, I love the fact that you bring up functional medicine. They were both on my show, Dr. Ardito and Dr. Graham. And, you know, and I know you see this also. Patients are asking for other options, not just traditional Western medicine. What else can they do? And I don't blame them, because the truth is, if we rely on traditional Western medicine, you know, we're really good at rescuing people, but we've been really bad at prevention and being proactive. So I love the idea of the functional medicine doctors getting involved, really a holistic approach to the patient, which I think is really important.
Definitely, yeah.
So, I mean, this is very exciting. And I really want to urge people who are watching this program today, please, please be proactive. Do not wait for your, I've said this a million times on this show, do not wait for your doctor to tell you you should do something. Doctors are busy, we're not perfect. Sometimes things are missed. So you must advocate yourself. And I will say right now, the Catholic Health Preventive Cardiology program is a perfect place to start advocating for yourself. So they need to call the number, and wherever they are, especially on Long Island, wherever they are, we'll find a preventative cardiologist for them, whether as far as Riverhead, where you are, in the middle of Long Island, where I am, in Smithtown and Bayshore, and in Nassau County and Queens. We will find a preventative cardiologist, but just make the phone call. What's the worst that can happen? We could tell them they don't need to be screened now, call back in 5-10 years, right?
Right.
So this was really great to have you on the show. I know you're busy, and I'm glad and appreciative that you took the time out of your busy schedule.
Thank you.
Coming up next, we'll learn more about each stage of the program and what you can expect. You're watching Stronger Together with Dr. Dave. Welcome back to Catholic Health Stronger Together with Dr. Dave. Today we're talking about Catholic Health's Preventative Cardiology program. We just got an overview from Dr. Pappas. Now let's learn more about the details of the program and how they'll benefit you.
My job function is, as the clinical coordinator of the Preventive Cardiology program, is ultimately going to be, number one, maintaining open and regular communication with our patients. I want our patients to be comfortable calling that phone number anytime, knowing that they can talk to me about any questions that they have, and helping to reduce the stress that can sometimes come with getting any kind of medical workup. Number two, my primary focus is going to be coordinating care so that patients don't have to stress about that. So when a person calls me as the coordinator, I'm not only going to be speaking with them regularly about how they're going to move forward with their workup, but I'm also going to be talking to the medical team. I'm going to be talking to the physicians and their secretaries to help coordinate appointments and make sure that nothing's falling through the cracks and that things are getting done in a timely fashion. The benefits of the Catholic Health Preventive Cardiology program are vast. The way that I look at it is that knowledge is power. And there are a lot of people out there who unfortunately don't always recognize that they are at risk until something more serious happens. And so the number one intention of our program is to mitigate that risk and prevent people from having issues that end up ending in some more serious consequences. An initial consultation with the Catholic Health Preventive Cardiology program, a person will call the Catholic Health Preventive Cardiology line. Once you call that line, you'll actually speak with me directly, and we will start by doing a very comprehensive initial intake questionnaire. So we'll do a pretty deep dive into your medical history, your surgical history, any previous cardiac problems you had, as well as any previous interventions you've had in the past. But not only that, we're also going to talk a little bit about how your stress level is, how your sleep is. So we're really focused on a whole person approach on that initial intake so that we can get a really good idea of who you are, how your health is currently, and what your risk is. And then after we go through that whole intake, we'll set you up with an appointment with Dr. Pappas or one of our other preventive cardiology physicians with St. Francis Heart. And from that point forward, we'll move forward in a diagnostic workup as well as any referrals you may need for any other subspecialties that we work very closely with in our program. A lot of people who don't realize they're not getting restful sleep as a result of sleep apnea. And something like sleep apnea can actually put a lot of strain on your heart over time. So a lot of people don't realize with undiagnosed sleep apnea, not only are you not getting good restful sleep, which affects how you feel on a day-to-day basis, but it also puts strain on your heart. Men typically are at higher risk of cardiovascular disease when we're talking less than age 65. When women reach menopause, they are then we consider at the same risk. And so menopause is a great factor because as our hormones change, it affects our risk assessment profile, and it does actually change the way that we would diagnose certain problems, find certain problems, and how we would treat certain problems with your heart. Family history can be a very important factor in knowing who needs early intervention, and it can also really be an important factor in letting us know who we need to pay closer attention to. We tailor every single patient's initial assessment based on who you are, what your history is, what your family history is, and what your individual risk may be. The other thing that I find so important about this program is not only are we personalizing your treatment plan, but we are also available 24/7 for questions. So treatment options are going to vary greatly based on what a person's diagnosis is. But that can range anywhere from just basic diet, lifestyle changes like exercising, a low sodium diet, a low cholesterol diet, as well as regular routine maintenance, following up with your primary care doctor once a year, making sure you're getting the appropriate lab work done and you're doing it in a timely fashion. However, that can range greatly to medication management, follow-up studies, all the way to the other end of the spectrum where in some rare cases patients may need a more invasive diagnostic approach to really understand how their heart is doing and if any intervention is necessary. We intend to follow up with you so that we can help you make sure that you're staying on track and address any issues that might come up along the way. We're going to have nutritional specialists, diabetes educators, a tobacco cessation program. We're starting to run an exercise program with some of our physical therapy units, really to help promote a healthy lifestyle in the long run. In all seriousness, I think that it is a really important program no matter how old you are, how young you are, what your physical, conditions are. Anybody who has a heart knows that we need to keep our hearts healthy. And this program is all about preventing negative outcomes from happening. We don't want to have a person hospitalized and then look back and say, okay, where do we need to make changes in order for them to mitigate their risk, to prevent this from happening, and to now treat this new disease.
This really sounds like a wonderful program that will help a lot of people. And coming up next, we'll hear from a patient who's currently enrolled in the program. You're watching Stronger Together with Dr. Dave. Welcome back to Catholic Health, Stronger Together with Dr. Dave. We just learned about a new program available at Catholic Health, helping you reduce your risk of heart disease before it becomes an issue. Now we're going to hear from someone who can speak to how this program has helped them and improved their quality of life.
I had no idea there was anything wrong in any way, shape, or form. And my doctor said, "You have the slightest bit of a murmur starting." He did the test. I get a call from him on a Thursday night at 8 o'clock at night. And he said, "Or I need you in St. Francis first thing in the morning on Monday morning. We're going to do an angiogram." I saw some things, and he said, "But I need you in first thing in the morning." I said, "Well, of course, I'll be there." And I went in, and sure enough, I had a blockage. I had no indication of it. No indication. I was overweight. I was tired, but again, it was certain stress that was going on. I had no indication of pain. I had nothing except that little sound of a murmur. And thank God I got in there, because when Dr. Pappas came back into the room in recovery, he looked at me and he took my hand and he said, "Or this one," and he motioned. This one artery was 93% clogged. This one was 95% clogged. This other one was 95% clogged. He said, "You were a massive heart attack waiting to happen, and you would not have survived it." And I sat there thinking, I was never short of breath. I could run up and down stairs. I was lifting and hauling things. There was nothing to indicate to me that something was wrong with my heart, and I had never had anything wrong with my heart. He said, "Okay, yeah, there's no question that you have to lose the weight." And I said, "I know." So I've actually, in a little over a year, I've lost 40 pounds. But it's a lot of work to do it, but you have to focus. I have 4 grandchildren so far, and I want to be here. He saved my life, and he acted so quickly, which was really, there was no fooling around. His team was wonderful. Right from the receptionist, even when you walk in the door, "Hey, how are you?" "Good, okay." And everybody's so efficient. When they do the sonograms or anything else, it's just right there on top of everything. And you know that they are, you can tell that they are. It was my doctor, Dr. Kalogeras, who actually knows Dr. Pappas. And he absolutely was going to see Dr. Pappas. As soon as he heard that little bit of, he said, "You're going to see Dr. Pappas." So that was why, and I was very, very happy. So you have to be very proactive. So I do go and I have my yearly checkup with my internist. I make a point of doing that. And luckily, he surrounds himself with doctors like Dr. Pappas. So he knows, if you need this, you're going to go to this doctor, you're going to go to that doctor. So I would tell people to just, and your heart, if anything happens to your heart, everything else goes, you know? So you really have to keep a check on that. I feel wonderful. I haven't felt this good for years. The program, Dr. Pappas is on top of everything. He communicates with my internist. He'll call you any time of the day or night. I would tell anyone to please come to Catholic Health. If it's especially heart-related, please come to Catholic Health, because it's a wonderful, wonderful team of people who really are interested and are there for you and take very good care of you. There's so many things in life to enjoy. Take care of yourself. And when you have a team such as Dr. Pappas's team that are there for you, then life can be much, much better than not having a team like that. The team was wonderful in helping me in any way that I needed it. And again, as I said, anytime I had a question of any sort, if I called the office, there was always an answer. It wasn't days later. The team was right on top of things. He saved my life, is what Dr. Pappas did.
Thank you to all of our guests today for sharing more about the Preventive Cardiology program at Catholic Health. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit CatholicHealthLI.org or call 1-855-CHS 4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.